Hello viewer, welcome to Pharma Digital, and here in this video I am gonna discuss about the anti-tubercular drug, and here the second segments of the anti-tubercular drug. Previously we briefly discussed about the isoniazid, and here in this video we discuss about the some extra or some 3 or 4 first line drugs. तो यहाँ पे इस वीडियो पे हम जो ड्रग डिस्कस करेंगे, पहला ड्रग जो है वो है रिफाम्पिन, जिसे हम रिफाम्पिसिन भी बोलते हैं, एंड इट इज़ एडमिनिस्टर्ड टुगेदर विथ आइसोनाइजिड, इथाम्ब्यूटल और अनदर एंटी ट्यूबरकुलर ड्रग. क्यों हम लेते हैं एक साथ? क्योंकि टू प्रिवेंट द ड्रग रेजिस्टेंस टू माइकोबैक्टीरिया. जैसे कि हम पहले भी बताता कि मैंने ये जो है सिंगल ड्रग को इजीली रेजिस्ट कर लेता है, तो इसीलिए हम मल्टी ड्रग थेरापी यूज करते हैं. तो रिफाम्पिन को हम इथाम्ब्यूटल और आइसोनाइजिड जैसे ड्रग के साथ मल्टी ड्रग थेरापी के हिसाब से हम यूज कर सकते हैं. एंड दिस रिफाम्पिन इज यूज्ड इन एन ऑल्टरनेटिव टू INH फॉर प्रोफाइलैक्सिस. यहाँ पे एक टर्म आया प्रोफाइलैक्सिस. प्रोफाइलैक्सिस मीन्स हम डिजीज को रोकने के लिए हम जो इनिशियली और पहले से ही जो हम दवाई लेते हैं उसे प्रोफाइलैक्सिस बोलते हैं. ज़्यादातर देखना रेनी सीजन में हम मस्कीटो का जो ग्रोथ है वो ज़्यादा रहता है, क्योंकि पानी इकट्ठा हो जाता है सोसाइटी में, तो हम उसे मस्कीटो बाइट से जो हमें मलेरिया होने का खतरा रहता है उसे हम रोकने के लिए जैसे कि क्लोरोक्विन्स और डिफरेंट एंटी मलेरिया ड्रग लेते हैं, तो उसे प्रोफाइलैक्सिस ट्रीटमेंट बोलते हैं. तो यहाँ पे रिफाम्पिन हम प्रोफाइलैक्सिस बेसिस के हिसाब से भी यूज़ कर सकते हैं. एंड जिस पेशेंट को आइसोनाइजिड जो है वो रेजिस्ट कर गया है और एलर्जी कंडीशंस है, उस केस में भी हम रिफाम्पिन को ले सकते हैं. And next is about the pharmacokinetic. It is highly plasma protein bound, and it is well absorbed orally and distributed all over the body tissue and fluid, means including CSF, means it also able to penetrate the blood-brain barrier, and it is able to metabolized in liver and excreted in urine and bile. Means if the drug is excreted in bile, then it also able to excrete through the stool. Next, its mechanism of actions. Rifampin binds with the bacterial DNA-dependent RNA polymerase. It is the enzymes which helpful for the synthesis of RNA. As we know, RNA is responsible for the protein synthesis. If this enzymes is blocked by the drug rifampicin, then no inhibition and no RNA synthesis occurs. That's why which leads to no protein synthesis. And if protein synthesis doesn't occurs in cell of bacteria, then no growth and multiplication of the bacteria occurs, which leads to act as a bacteriostatic. नेक्स्ट इज ड्रग इंटरेक्शन. जैसे कि हमें पता है कि ड्रग इंटरेक्शंस मीन्स हम कोई भी ड्रग लेने के दौरान अगर दूसरा कोई ड्रग लेते हैं तो क्या इफेक्ट आता है, उसमें डिक्रीज होता है और उसका इफेक्ट डिक्रीज होता है और इंक्रीज होता है, वो स्टडी करते हैं ड्रग इंटरेक्शंस में. तो यहाँ पे क्या होगा, रिफाम्पिन एनहांस द ड्रग मेटाबॉलिज्म ऑफ मेनी ड्रग्स इंक्लूडिंग वारफरीन, ओरल कंट्रासेप्टिव, कॉर्टिकोस्टेरॉइड, स्टेरॉइड, डिजिटॉक्सिन्स, मेटोप्रोलोल, फ्लूकोनाजोल एंड कीटोकोनाजोल. मीन्स अगर हम रिफाम्पिन को ये सब ड्रग कैटेगरीज के साथ लेते हैं तो ड्रग का जो एक्शन है वो बढ़ जाएगा. नेक्स्ट इज एडवर्स इफेक्ट. हेपाटाइटिस. एज वी नो, हेपाटाइटिस मीन्स लिवर इन्फ्लामेशंस. नेक्स्ट, इफ वी डिसकंटिन्यू दिस ड्रग बिफोर द कोर्स ऑफ थेरापी, इट मे बी क्रिएट जॉन्डिस. एंड नेक्स्ट इज respiratory syndrome. Respiratory syndrome means breathless, which may be associated with shock and collapse. As you know, shock means less of oxygen in our body. And besides able to cure this leprosy, rifampin are also able to use in different treatments like leprosy, and it also used in treatment of meningococcal and H. influenza, which infect the meningitis. And it is also used in combination with doxycycline and in the first line treatment of brucellosis. Brucellosis means it is a bacterial infection which comes from the if we consume raw animal source, like without boiled milk or without boiled egg. and it is also used as a second and third stage drug for MRSA. Here MRSA means methicillin resistant streptococcal aureus, मीन्स जो बैक्टीरिया मेथिसिलिन जो कि एक एंटीबायोटिक्स है उसे रजिस्ट कर लिया तो भी हम उस केस में एज ए सेकेंड एंड थर्ड चॉइस के हिसाब से यूज कर सकते हैं, बिकॉज रिफाम्पिन इज ऑल्सो ए एंटीबायोटिक्स एंड इट इज़ ऑल्सो यूज्ड इन diphtherial infections and legionella infection. It is also a respiratory infection which create coughing and breathless symptoms. And next we discuss about the second drug of this videos, that is the pyrazinamide. And first we discuss about the mechanism action of pyrazinamide. Here, after administration of pyrazinamide, it is converted into the pyrazinoic acids by bacterial enzyme pyrazinamidase. Means initially this pyrazinamide is inactive forms. After conversion of the pyrazinoic acid by the bacterial pyrazinamidase, it inhibits their growth and developments, which leads to their kill of the bacteria. And this drug is effective in initial stage of the treatment, means infections which are not more than 2 months. Next we discuss about its pharmacokinetic. It is absorbed orally. It has a good distributing properties and penetration to the CSF, extensively metabolized in liver and excreted in urine, and it has a plasma T half period 6 to 10 hours. Next is adverse effect. It leads to hepatotoxicity, means liver inflammations, hyperuricemia, means excess uric acid levels present in blood, which maybe leads to kidney damage in future, and frequently used cause the jaundice and skin rashes, nausea and vomiting are the common side effect associated with pyrazinamide. And the next drug is ethambutol, and here the mechanism action is not completely understood, but it has been found that inhibit arabinosyl transferase involved in formation of the arabinogalactans, which leads to formation or polymerizations of the different cellular synthesis. So here the drug is block the arabinosyl transferase enzymes, which leads to no arabinogalactans form, and which leads to no polymerizations of the bacterial cell wall, and which leads to their inhibition of cell wall and death of the bacteria. Next is pharmacokinetic. About 3/4 upon oral doses orally absorbed, and it is distributed widely but penetrates meninges incompletely, means it able to cross the blood-brain barrier poorly, and it is temporarily stored in RBC, and less than half of the ethambutol is directly metabolized by the liver, and remaining is excreted by the glomerular filtration and tubular secretion, which are associated with the secretion of the urine or formation of the urines. Means this drug are morely excreted through the urines, and it has a plasma T half approx 4 hours. Next is side effect. Patient acceptability of E is very good because it has a good pharmacological rate with lesser side effect, and but as we know, every drug has produced some side effects if we take it for a longer period. Like it also produce hyperuricemia, means excess uric acid in blood that may leads to kidney damage in future. Optic neuritis, means the inflammation of the optic nerve, which leads to blurry visions or a blurry image produced. And because young children may unable to report early visual impairments, it should not be used below 6 years of age. मीन्स यहाँ पे सिंपली बोला गया है कि जो छोटे बच्चे हैं उनके जो आँखों का जो दिक्कत रहता है वो मतलब ठीक तरीके से वो बता नहीं पाते, क्योंकि उनके जो ग्रोथ ब्रेन का ग्रोथ एंड डेवलपमेंट्स जो है वो इमैच्योर तरीके से होता है। तो यहाँ पे 6 साल से कम वाले बच्चे में हम ये ड्रग यूज़ नहीं कर सकते, क्योंकि ये ऑप्टिक न्यूरिटाइज करता है। And the last drug that we discuss in this video is streptomycin, and it is the last drug of the first line, and it is the first clinically useful anti-tubercular drug, and it is tuberculocidal, means it able to completely kill the mycobacteria, but it is less effective than isoniazid or rifampicin, and it acts only on extracellular bacilli, means those the tubercle bacilli are penetrate into the macrophage or cell. These drug are unable to treat that. Next, here we discuss about the some pharmacokinetic properties of streptomycins, means here the penetration of tubercular cavities. It able to penetrate into tubercular cavities, means those part who is affected by the tubercle bacilli, the drug is able to penetrate but doesn't cross the blood-brain barrier, means it able to unable to penetrate the cerebrospinal fluid, and it has a poor actions in acidic medium, that's why it unable to penetrate into the cell, and about 30 to 40% of the drug is bound to plasma protein and metabolized in liver and excreted through the urine. Next is mechanism of actions. It combines with the bacterial ribosome, and this prevents with the RNA and ribosome combination. As you know, RNA and the ribosome both are associated with the protein synthesis. As you know, protein is a necessary vital components for the cellular synthesis of the bacteria, and these streptomycins are inhibit the combination of the bacterial ribosome and RNA. Due to these inhibitions, this drug are produce wrong amino acid or faulty amino acids and produce proteins which may be deathful for the bacteria. Next, some side effect associated with the streptomycins, and it is a drug that are must be taken intramuscularly, so it gradually decrease their uses because some of the patients are inconvenient with the parenteral routes, and the lower margin of safety, means it create ototoxicity, means ear damage, and nephrotoxicity, means nephron damage. The nephron are associated with the kidneys, means these drugs, these streptomycins or this streptomycins drug is completely associated with the ear damage, hearing loss, and kidney damage or nephron damage, and especially in elderly and those with impaired renal functions, means in case of elder persons and those have a kidney problems, this create nephrotoxicity. And here all the summary of mechanism action of the first line drug. Here isoniazid is inhibit their mycolic acid synthesis, and ethambutol inhibit the arabinogalactans, and pyrazinamide inhibit the plasma membranes, like that. Rifampin it inhibit the DNA gyrase RNA synthesis. So all the bacteria are produce its action according to different mechanism of actions. And here the recommended dose of first line anti-tubercular drug for the adult, not for the child. Here the dose is for the adult. If you want to note down, you may take a screenshot. Here all about the today's video, here we complete about the details description of the first line drug, that is RIPES. It contains 5 drug RIPES. Have a good day. Thank you.